Everyone's body has a natural defense mechanism called the immune system. And one of the first barriers of protection lies in our skin. Cells which make up the skin are normally made and replaced every 3 to 4 weeks. But in people with psoriasis, the natural immune system is overactive, causing the skin cells to be overproduced and replaced every few days. This leads to a build-up of skin cells which can be itchy and painful. Psoriasis can look different on different people based on their skin colour or the type of psoriasis. The most common type is plaque psoriasis. On white or fair skin, it can appear red or pink with silvery or white flakes of skin. On skin of colour, it can appear darker or purple with grey flakes. Psoriasis is not contagious, so it cannot be passed on from skin to skin contact. The exact cause of psoriasis isn't fully understood, but it's thought to be a combination of genetics and environmental factors. Certain genes passed on from your parents can make you more likely to develop psoriasis. Environmental triggers can switch on these genes, causing psoriasis to develop. These triggers could be a stressful moment in your life, a serious skin injury, or infections such as certain throat infections. Psoriasis can come and go, but for most people it will affect them long term, and triggers can cause it to flare up. For many people, psoriasis isn't limited to the skin. It can also affect the joints and the nails. Treatment for this can sometimes be difficult. Psoriatic arthritis is when you have swelling, pain and stiffness in the joints, such as the knees or wrists. If you develop psoriatic arthritis, you may be referred to a rheumatologist, a doctor who specialises in certain musculoskeletal conditions. They can confirm your diagnosis and may prescribe treatments to help manage it. Dealing with the different aspects of psoriasis within your day-to-day can take its toll on your mental health. It's also possible it affects how you feel about yourself. It may impact your self-esteem, or you may just feel exhausted by it all. This is perfectly normal. People often have good and bad days living with psoriasis. But the key to living well with psoriasis is following your prescribed treatment plan and looking after your mind and body as best you can. This includes eating healthily, regular physical activity, and keeping up an active social life. This can help combat stress, a common trigger for psoriasis. Others with psoriasis have said learning how to manage stress and practicing self-care was key to controlling their condition. Remember, you're not alone in living with psoriasis or a skin condition, which means there's lots of places to find support. And if you're struggling, find someone you trust to talk to, such as a family member, friend or co-worker. You can also speak to your healthcare team. While there's currently no cure for psoriasis, there are lots of ways to manage and control it. Regularly using emollients can help moisturize and protect the skin. You can also use emollients instead of soap to avoid irritation and provide relief to itchy skin. You may be prescribed topical treatments, such as steroids or vitamin D creams as a first line of treatment, or to help manage flare-ups. For some, these are enough to control the psoriasis, but if it's more severe or not responding to topical creams, you may be offered an additional type of treatment. This may include light treatment, also known as phototherapy, oral medicines or injectables. Your healthcare team will talk to you about the most suitable options for you. To reduce the risk of flare-ups, try and avoid your specific triggers. This could be stress, smoking, alcohol, infection, skin injuries such as sunburn, or certain medications. Your healthcare team can advise which medications may trigger your psoriasis. Understanding your skin and how it reacts to different things can help you learn how to control it. Keeping a journal of how you react to medicines, how you're feeling, and possible triggers may help you spot trends or patterns. This can also help guide conversations with your healthcare team. If one treatment doesn't work, don't be disheartened. Finding the right treatment for you may be a process of trial and error, but there are plenty of options that may work for you. Speak to your healthcare team to discuss the different treatments available. You can also ask them about prepayment certificates to help cover the cost of prescription emollients or topical treatments. And remember, accepting and understanding the skin you're in can set you off on the right path of your psoriasis journey.